Okay, in the female, we want to know what's anterior, what's posterior, and what's intermediate. And this is going to be called the vestibule, huh? This is not the vagina. This is the vestibule. And it's bordered by the labia minora. These are the labia majora, okay? And the urethra is going to be anterior, the anus supposed is going to be posterior, and in between the two is where the vagina is going to be positioned, okay? So we need to be aware of those things. This is something that is almost intuitive, I think. Okay? So, here's another thing. That pudendal canal. That pudendal canal is a special thing. It's located on the lateral side of the ischiorectal fossa, and it's a specialization of this fascia. And it's the fascia of the obturator internus that forms this pudendal canal. Another thing that the fascia of the obturator internus forms is this arcus tendineus up here. Okay? But the pudendal canal is clearly a specialization of the obturator internus. What happens to these things as they pass back here and converge? Well, what happens is the vas deferens comes in here, and if we were studying the abdomen, I'd tell you all about that. Right now, really, that's something beyond where we're studying. But this is the vas deferens, or the ductus deferens, and clearly the ductus deferens comes down here. It's joined by the seminal vesicle, and together with the seminal vesicle, they form the ejaculatory duct, and they empty into the prostatic urethra. Okay? Next thing is the cardinal ligament. Cardinal ligament is going to be a major factor in holding the uterus in place. Okay? And what does it attach? Well, excuse me. What it's going to attach is the pelvic wall over here, which is going to be bony and pretty stable, to the uterus, which you want to make stable. Okay? So you got this thickening of all this fascia around here, around the uterine vessels, a real thickening of fascia that we don't see in the gross lab, but might be a little bit more conspicuous in a live person. That cardinal ligament is thought to be the main reason that the uterus can be prevented from prolapsing. And it attaches the uterus to the wall of the pelvis, okay, right across there. How about the structures that we mentioned previously coming out of the greater sciatic foramen, passing in through the lesser sciatic foramen? We made a big deal about the obturator internus coming out of the lesser sciatic foramen, right? Well, what goes into the lesser sciatic foramen? Well, what goes in there are three things that hopefully we got some appreciation of. That's the pudendal nerve, most medial, nerve to obturator internus, most lateral, and then the internal pudendal artery, because there is an external, okay? There's no internal pudendal nerve, despite what one of our diagrams was labeled. It's just the plain old pudendal nerve, because there is no other. But this is the internal pudendal artery, because there is an external pudendal artery on the front of the body, okay? So it's the internal pudendal artery that's between these two nerves, passing out of the greater sciatic foramen, passing back in through the lesser sciatic foramen. All right, I've added something here, hopefully to clarify what questions you might have had related to anthropoid versus platypilloid pelvis concerning the anterior-posterior ratio to the transverse diameter. So hopefully this makes sense to you. In the anthropoid pelvis, you're going to have a higher AP to transverse diameter ratio. See that? How that's longer? Especially compared to this, we have a decreased AP to transverse diameter ratio. This is shorter, and this is longer. Okay? So your AP to transverse ratio is high in anthropoid. Your AP to transverse ratio is low in the platypilloid. Gonocoid is mostly circular. Android is said to be heart-shaped in the closed male, as you'd expect from its name. Okay, then we're interested interested in things that pass through the pelvic diaphragm. The rectum really is the only thing in the anus that passes through the pelvic diaphragm, because the urethra, the deep dorsal vein of the penis, the vagina, all mainly pass through the urogenital diaphragm, because this is an opening right there. That V shape is an opening in the pelvic diaphragm that's closed by the urogenital diaphragm. Remember we said the urogenital diaphragm is inferior to the pelvic diaphragm? Here looking above, we can see that. There's the pelvic diaphragm, there's the urogenital diaphragm, filling in this space. So the vagina, the urethra, the deep dorsal vein of the penis would be going through the urogenital diaphragm. The anal canal is going to be what passes through the pelvic diaphragm. Okay? All right. Innervation of the pelvis. Parasympathetic is going to be important for sensation. Distension of the bladder, distension of the rectum, need to pass urine or feces. Pain from the uterus is going to have a parasympathetic component, but it also has a sympathetic component. Okay, so the uterus is different from the other two major organs in the pelvis in that it has two sensory pathways. Not only parasympathetic like the others, but sympathetic also. Okay? With regard to motor function, parasympathetic is going to be responsible for erection. All right? So parasympathetic is going to have a sensory function in this respect. It's also going to have a motor function with regard